For some reason, I have seen a ton of patients who have been told incorrect information about Buspar. So today, I'm going to bust 5 of the most common myths I've come across, and myth number 1 is that Buspar only needs to be taken once per day. This one just hurts every time I hear it because I've seen so many patients whose providers started them on this medication only once per day, and then they come to me wondering why the medication hasn't been helping. My friend, this medication needs to be taken twice per day, and I've seen even some people on it 3 times per day. The reason behind this is that Buspar has a relatively short half-life, which is around 3 hours long. So a typical starting dose would be 7.5 milligrams twice daily, with the max dose being 30 milligrams twice daily, so 60 milligrams total. Myth number 2 is that benzodiazepines are better than Buspar at controlling anxiety. Studies have shown that in head-to-head comparisons, Buspar holds its own. One in particular was published in the Journal of Clinical Psychopharmacology, and it found that Buspar was more effective than placebo and comparable to lorazepam, which is Ativan. In addition, patients on Buspar had no rebound anxiety and fewer side effects than those on lorazepam. Myth number 3 is that Buspar is approved for the treatment of depression. This one is actually pretty interesting. Buspar only has one FDA indication, and that's for generalized anxiety disorder. Now, some people have tried using it as a helper medication for treatment-resistant depression, and the results have been pretty lackluster and mixed. Generally, it's been shown to be less effective for depression augmentation than lithium, atypical antipsychotics, thyroid hormone, and Wellbutrin. However, it might be a good option if you're someone who has struggled with side effects from these medications, and that leads us to myth number 4, which is that Buspar is difficult to tolerate. The vast majority of people I treat are able to tolerate Buspar far better than the other medications typically used for depression and anxiety. So whenever someone struggles with, say, SSRIs or SNRIs, for example, Buspar is one of my next go-to options because of how well they do on it. The most common side effects include dizziness, drowsiness, headaches, and nausea, but these typically go away for most people after around a week or 2 of being on the medication. Another nice thing about this medication is its dosing flexibility and our ability to use very small doses if needed, which further reduces the potential for side effects because it allows us to really tailor the dose to the individual. Myth number 5 is that Buspar is addictive. Many people believe that Buspar is similar to the benzodiazepines, where prolonged use can lead to dependence, tolerance, and abuse. This is not the case. Buspar works mainly by affecting serotonin receptors, where benzodiazepines affect GABA receptors. Their mechanisms of action are totally different. Now, if you're looking to learn more about Buspar, make sure to click that next video.